Hello everyone, good evening to all. I hope you had a wonderful day till now, and further also you will. I'm your physiotherapist Nisha Castellino, welcoming all of you for today's session on behalf of Sanjeevan Physios. Well, as we all know what Sanjeevan Physios is all about, this is for the uninitiated. Sanjeevan Physios is a group of visually challenged physiotherapists who render their services for the people of Worli, Mumbai. We are located at Sri Telugu Sudharak Yuvak Sangam, flat number 2, building number 111, BBD Chol, Worli, Mumbai. We also have another center at Goregaon East, which is run by Dr. Shraddha Shinde. As we proceed, I would like to introduce today's topic to you. It is on muscle energy technique, which will be led by Ms. Tejaswini ma'am, who is a BPT final year student from Sanjay Gandhi Institute of Trauma and Orthopedics, Bengaluru, Karnataka. Now, before we proceed, there are some honorable mentions as such. You participants are requested to keep your mics on mute. All your queries and suggestions can be posted in the chat box, which will be read and replied later. And you will also be sent a feedback form, which we will appreciate if you fill it up with your suggestions and with your comments. So as we proceed further, I give it over to Tejaswini ma'am. Okay, Tejaswini ma'am, please take over. Thank you and meet you all.
So talking about muscle energy technique. So firstly, this is like moving on to the definition. It is a system of manual procedures that utilizes active muscle contraction, effort from the patient against a controlled matching counter force from the physiotherapist. So basically, what does the definition tell? The patient will perform an active muscle contraction, and it will be, am I audible?
Yes, ma'am.
Yes,
Okay.
ma'am.
Okay, thank you. So it will be therapist will apply a counter force to the active muscle contraction produced by the patient. Okay, that is the definition. So moving on to the physiological mechanisms. So basically there are two physiological mechanisms which happen here. That is the Golgi tendon organ reflex and the muscle spindle reflex. These are the two reflexes which we'll be seeing ahead. So, and one more thing, what happens is there is the resets. It resets the neurological resting length of a muscle. So this also I'll discuss. What they are telling is once you do the MET technique, the length of the muscle is going to increase. Okay, that is what it means. So moving on to the types. So basically there are two types. One is autogenic inhibition and reciprocal inhibition, MET. Okay, under autogenic inhibition there are two types. One is post isometric relaxation and the other one is post facilitation stretching. Okay, these are the two types under autogenic inhibition. Okay, now talking about the two different things, that is autogenic inhibition and the reciprocal inhibition. As you can see the muscle spindle over there, the red fiber-like structures, and the GTO. What is GTO? That is the Golgi tendon organ. Those are the round circle ones. Okay. So talking about autogenic inhibition. Here what happens is the Golgi tendon organ, which is, when does this activate? When does this respond? It responds in case of increased tension. Okay. And further, it inhibits the muscle contraction. That is how the autogenic inhibition works. Further, moving on to reciprocal inhibition. So muscle spindle is there. What it will respond to muscle lengthening. If there is muscle, it is responsible for muscle lengthening. Okay. And further, it causes muscle contraction. So this muscle contraction, basically this is responsible for the deep tendon reflexes, and it inhibits the antagonistic muscle. Okay. That is how reciprocal inhibition happens. We'll discuss this in further slides as well. Okay. I hope this is, you understood these two different inhibition techniques. Further, moving on to the indications. So basically, indications and uses of MET, it is used to lengthen and desensitize the myofascial tissue in case of pain, in case of shortened muscle. So in that cases, this is very useful. And further, what are the indications? In case of myofascial trigger points, acute myofascial pain, fibrotic shortened muscles, and also tight muscles which are affecting the posture. Okay. So further, there are basic elements of MET. That what are the basic elements? Basically, there are 5. First one is patient is going to perform active muscle contraction. After that, there is controlled joint positioning. This is the therapist will take care of this thing. Okay. And the third one, muscle contraction in a specific direction. Okay. And fourth one is therapist applied distinct counter force. Okay. Both the patient is performing a movement and there is a counter force applied by the therapist for that movement. Okay. So that there is this isometric contraction which will happen. Okay. So controlled contraction intensity. Okay. These are the 5 different basic elements of MET. What is it? It is that first the patient is going to actively perform the muscle contraction, followed by the therapist is going to take him and position the joint. That control is in the therapist's hand. Okay. Further, there is muscle contraction in a specific direction, and therapist is going to apply a distinct counter force so that there is isometric contraction happening. After that, there is controlled contraction intensity. That is also in the therapist's hand. Okay. Further, moving on to the barrier. What is this barrier concept? So basically in MET, we are going to cross the barriers so that we lengthen the muscle, reduce the pain, and correct the posture. So in that case, we will have to cross this physiological barrier, elastic barrier, and then this anatomic and restrictive barrier. Restrictive barrier is when there is movement restriction. Then you perform MET and then take them to a new barrier and then again repeat the technique. Okay. Moving on to the principles of MET. There are 2 principles. One is post-isometric relaxation and the second one is reciprocal inhibition. Okay. Talking about post-isometric relaxation. That is, after a muscle is contracted, it is automatically in a relaxed state for a brief period. That is called the latent period. During that period, what happens is there is the muscle, once it is in one particular contracted state, after that, the next coming few seconds, it will go to a relaxed state. That is called post-isometric relaxation. Okay. Okay. Moving on to the method. How do you perform? So in case of, this is performed in case of hypertonic muscle. Okay. So how do you perform? You should all sit back and imagine. So we take the muscle to a lengthened position. Okay. And then there is 20% of strength contraction for 5 to 7 seconds. Okay. So that means there is isometric contraction performed by the patient, and the therapist will give a counter force for this. Okay. And the third one, this is performed for 3 to 5 times. The technique is repeated for at least 3 to 5 times for the better results. Okay, this is the method. It is performed in case of hypertonic muscle. Okay, moving on to the reciprocal inhibition. Okay, what do you mean by reciprocal inhibition? When one muscle is contracted, its antagonistic muscle is automatically inhibited. Okay, always in order to perform one particular specific movement, the contraction should happen in one muscle, and the lengthening or the relaxation of the other muscle will lead to one particular movement. So that is what is this reciprocal inhibition. Moving on to the uses. So one thing is lengthening. Okay, lengthening of a shortened muscle or a contracted or spastic muscle. Then you will strengthen. The third one is you will reduce pain, stretch tight fascia, reduce localized edema, mobilize and articulation with restricted mobility. Basically, we are working on the entire joint, like the muscle. Whatever shortened muscle is there, you will lengthen it, you will strengthen it. If there is pain, you will reduce the pain. And once you lengthen, strengthen, obviously, if there is edema or edema around it, it will also reduce. Okay, and the joint mobility also will increase. So these are the uses of MET. Okay. So after that, moving on to the procedure. So how do you perform MET? Basically, I'll read out what are the steps involved, and then we'll look on to one particular. We'll take one particular muscle and perform. Okay. So there is this 3 to 5 repetitions for 7 to 10 seconds each, and further 20 to 50% of muscle strength. Okay. So isometric contraction should not be too hard. These are the guidelines in order to perform MET successfully and safely. Okay. After fourth point is after sustained light contraction, there is a momentary pause, which is important for the muscle to relax so that it goes back to a new barrier. Okay. There is that lengthening happening. Okay. Further, moving on to the fifth point, that is isotonic contractions requires forceful contractions. So if you are performing like stretching, now once you have done MET, once there is this isometric contraction phase, there is this 25 seconds of stretching which we perform, so that we take that particular muscle to that particular movement can be taken to a new barrier. Okay, thereby we lengthen it. Further, talking about breathing during MET. So basically, first you will inhale slowly as the isometric contraction builds up. I hope you understand what is isometric contraction. That means like the length is not changed; it is constant. Okay. And then the second one, hold the breath during the 7 to 10 seconds. Like when we perform the isometric contraction, during that moment, for that seconds, for those few seconds, you are holding your breath. And then when we release, during the release phase, you will exhale. Okay. And then inhale and exhale fully once more, following all the cessation efforts. Basically, breathing is during the isometric phase, you are going to first you will inhale, and during that isometric contraction phase, you will hold your breath for that 10 seconds, and then once that is done, you will exhale. That is the breathing which is followed in MET. Okay. for the successful performance of MET, you need that control. You should place the joint in particular. You'll place the particular joint in that position and then stretch accordingly. Your force is very important. And then balance and localization. These are the three things which you need to take care while performing MET. Okay. Indications: myofascial restrictions in case of muscle imbalances, and then muscle hyperactivity, acute injuries, movement restriction due to muscle tightness, and restricted hypertonic muscle and fascia. These are the indications. Talking about the contraindications: fracture, severe sprain, severe strain, open wound, and this metabolic bone diseases, you should be cautious while giving MET in case of osteoporosis and all that. And people who do not understand, who do not cooperate, you cannot perform on them because your direction is very important while performing MET. Okay. Moving on. So talking about post-isometric relaxation, what is the mechanism? So basically, I was keep on telling this, what is this isometric contraction? So it is that the muscle will not lengthen, only there is tension produced. So you, the patient performs a movement, you resist it. He's trying to, you are trying to give a counter force to that movement so that there is isometric contraction happening. Okay. So isometric contraction of the muscle, then inhibition of antagonistic, and which is induced by this intrafibral stretch of the agonist. Okay. What does this do? It reduces the muscle tone of both agonist as well as antagonist. Thus, the shortened agonist muscle on isometric contraction is going to achieve a degree of ease due to the intrafibral stretch. Okay. Basically, because of isometric contraction, there is a lengthening of that particular muscle which was shortened. That's it. Okay. That is the mechanism happening in case of post-isometric relaxation. Further, yeah, talking about reciprocal inhibition. Okay. Basically, here also, suppose we're taking an example of elbow extension. Your biceps is tight. There is limitation. Everybody do this. So there is biceps is tight and limitation of elbow extension. So the person is trying to flex, and you are going to counter force. You're going to give a counter force. You're going to resist it. During that time, if you hold it, you will resist for that 7 to 10 seconds. There is isometric contraction happening. After that, there is lengthening of that muscle. Okay, that is what is spoken in case of reciprocal inhibition. Your further, here it stimulates it stimulates the same muscle by alpha motor neurons, whereas inhibits the antagonistic muscle by gamma motor neurons. Okay, this is known as antagonist relaxation due to agonist firing. Basically, that is what I told. So elbow extension is performed by your triceps. So you need to relax this biceps, which is tight, which is overpowering. So you need to inhibit that in order to perform full range elbow extension. That is the example. I hope you understood this reciprocal inhibition. Okay. Yeah. Now talking about autogenic inhibition. Autogenic inhibition MET, which is also called post-isometric relaxation. What are the steps under it? There is this stretch. First thing is stretch the involved muscle until you reach the barrier. Okay. Then isometric contraction. Further, there is this muscle relaxation. Re-engage the barrier. Repeat and re-examine. So stretch the involved muscle. Basically, what you are doing, you are going to stretch that involved muscle to you will reach the barrier and you are trying to stretch. So how will you give that stretching force? It depends on the pain. If the pain is more and the patient is perceiving the pain more, then you have to provide light stretching force. if the joint is pain-free or the perception is a little mild, so that time you can give moderate stretching force. Okay. Further, the second one was isometric contraction. So you will ask the patient to contract the targeted muscle and advise the patient to inhale before they contract the muscle. Okay. So here also, this isometric contraction is performed so that you push the muscle, you push the movement away from the barrier. You perform this so that you push the movement away from the barrier. So what here also there is this light contraction in case of painful joint, and if there is no pain, if the person, if it is pain-free or the fibrotic muscle, then you can give moderate contraction force. Okay, that is the second one, isometric contraction. Talking about muscle relaxation. So after this 7 to 10 seconds of isometric contraction, you should give enough time for the muscle to relax. That is, the patient should fully relax for several seconds with the stretch maintained for 10 seconds. Okay, advise the patient to take a deep exhalation to assess relaxation. Okay. Further, re-engage the barrier. Again, you need to remove the slack that has developed in the tissues. Sir, is my screen visible?
Yes, ma'am.
Okay,
yes,
so I'll continue. The muscle then can be stretched to a new barrier without using the increased force. Okay, basically, why do you give that period of relaxation, which this muscle relaxation, in order to, for the muscle to understand the new range. Okay, it once the muscle is shortened, once you take it to a new barrier, you should give enough time for the muscle to understand the new range, and then you will re-engage, remove the slack, and then the muscle can be stretched easily. You need not give much force. You can easily stretch the muscle without any barrier, because you are already breaking the barrier and moving on to a new barrier. So that is how you perform this. Re-engage the barrier. Okay. And again, you will repeat the process for 2 to 4 times or until a change in the tissue texture is found. Okay. And after that, you have to re-examine to determine whether the tissue have changed. Okay. So basically, we were talking about this fibrotic, shortened tissues, shortened muscle. So you will find the difference after performing MET. So until that happens, you will have to perform at least 5 times, like 2 to 5 times. Okay. So there is one more thing under autogenic inhibition, that is post-facilitation stretching. What does that mean? So in post-isometric relaxation, what we were talking about, we are just going to perform the movement for 5 to 10 seconds with 20% of counter force. Like the therapist is giving a counter force of 20%, and the patient is also performing the movement. Okay. So here in post-facilitation stretching, there are two differences, two major differences. One thing is the muscle is placed between a fully stretched and a fully relaxed state. Okay, a maximum degree of effort is used in isometric contraction for 5 to 10 seconds. And then after that, there is a rapid stretch which is applied by the therapist to reach a new barrier. Okay, that is the difference, because there is a rapid stretch which you perform as soon as there is isometric contraction, and in the isometric contraction phase also there is Sir, I'm not able to share.
मैम अभी आप शेयर कर पाएंगे?
The affected muscle is placed in a mid-range position. So wherever there is restriction to that position, you place it. Okay, I am explaining this again. Wherever you have the restriction or the mid-range position, you will place it and the patient pushes towards the restriction or barrier, whereas the therapist completely resists. You can see the counter force between the both the hands, okay, the forearm. This is followed by relaxation of the patient along with exhalation, and the therapist applies a passive stretch to the new barrier. Okay. So the procedure is repeated between 3 to 5 times everywhere until there is that positive result, whatever you expect. Until that result, at least the maximum limit is 5 times you can perform MET. And there is this 10 to 20% of muscle contraction, maximum muscle contraction in case of post isometric relaxation as well as reciprocal inhibition. In these cases, the counterforce applied by the therapist as well as the patient will be 10 to 20%. Okay, so which method should be used? So here basically this reciprocal inhibition is performed in case of acute conditions where there is pain, where there is inflammation going on and there is pain. All those inflammatory mediators are released, which causes pain. During that time, in order to relax the muscle, you perform this. So this reciprocal inhibition does not involve contraction of the affected muscle, and it is used in acute conditions where both other techniques like post-isometric relaxation and post-facilitation stretch both can cause adverse effect such as pain or injury. In that cases, you perform this reciprocal inhibition. Further, talking about post-isometric relaxation. This is the progression of the reciprocal inhibition where the affected muscle has become less sensitive. मतलब अभी pain कम हो गया है. So during that time, you can perform post-isometric relaxation technique. Okay, and the muscle is able to tolerate this isometric contraction. मतलब counter force को it can tolerate. Further, talking about post-facilitation stretching, this is for chronic conditions where the muscle is fibrotic, shortened, and here it gives good results. The lengthening happens better because there is a rapid stretch. There is that 20 seconds of relaxation which happens. So because of that reason, post-facilitation stretching is better. It gives good results compared to post-isometric relaxation. So let's get practical. So talking about upper trapezius. So look at that picture where there is that counter force applied. So basically what the therapist is trying to do. Okay, let us, I'll talk about the technique and then I'll show you there. So basically, first thing is the shoulder is firmly depressed and stabilized. Okay, first step. And the neck is flexed and side bent away from the involved side with rotation of the neck. Okay, so basically the patient has to perform this isometric contraction. Okay, I'll show you. So here the neck can be taken to you can side bend the neck and rotate. Okay, and you can resist towards the head. And one more thing, what you can do is you can depress the shoulder and you can ask the patient to elevate. So there is, in order to lengthen the upper trapezius, what you do is, there are two choices for you. One is you can depress the shoulder and ask the patient to elevate. There is counter force happening between the therapist and the patient's shoulder. The patient is trying to elevate and the therapist is performing that depression against the movement. Okay, he's giving a counter force. When you perform this for 10 seconds, 7 to 10 seconds, or 10 seconds. After this, you will take the patient's neck to a new barrier. You will try to stretch the muscle and hold it for 20 seconds. Okay, so you will take the patient's neck towards a new range, new barrier, so that the muscle, there is re-education, muscle re-education which is happening, and you reach a new barrier by breaking the old one. So the shortened muscle is lengthened by performing this MET, post-isometric relaxation. Okay, I hope you understood this. What I was talking about is the third point. The patient is going to perform isometric contraction. So for that thing, there are two ways you can perform this. Either you perform neck extension with side bending towards the involved side, or you can ask the patient to elevate the shoulder and the therapist will give that counter force. Okay, by that you will perform this isometric contraction for 10 seconds. That is our first step. What is our second step? Wherein you will perform the stretching for the upper trapezius, that is side bending. You will stretch it, and what you do is you will hold there for 15 to 20 seconds for the muscle to learn that new position. Okay, you will give time, and along with that, you will ask the patient to breathe, exhale. You will give a command, and you will perform the movement. And once this is done, you will give enough time for the patient to relax. Okay, that is how this post-isometric relaxation technique is performed for upper trapezius. Okay, so you can perform this. So here they have showed it in lying position. You can perform this in sitting position as well. Okay, and then there is pectoralis minor as well. So one example of upper limb, and one more I'll take for the lower limb. Okay, that is we'll talk about hip flexor muscle post-isometric relaxation. How do you perform? So basically, the shortness of iliopsoas rectus femoris, pectineus, and tensor fascia lata is common. So you have to stretch, you have to lengthen these muscles, that is iliopsoas, rectus femoris, pectineus, and tensor fascia lata. So how do you perform? When this muscle is tight, they restrict hip extension and will cause anterior pelvic tilt. So how do you correct that? You will perform this post-isometric relaxation on them. Okay, so this is the Thomas test position. Okay, or hip flexor stretch test position. So like the patient, unaffected leg of the patient is flexed by the patient himself or herself, and the affected leg, there is counter force. The patient is trying to perform, as you can see here. So the patient is trying to perform hip flexion, and the therapist is giving a counter force. Okay, and there is isometric contraction happening here for 10 seconds. Okay, after that, what is the second step? It is, you need to stretch. You need to stretch for 20 seconds. Okay, you will stretch for 20 seconds and ask the patient to breathe. You will command, as well as after that is your relaxation. You should allow the patient to learn that new position, and that is how you lengthen the muscle. Okay, so the same thing is given here. Patient is treated in the Thomas test position. So Unaffected leg is fully flexed, first point. And then what do you do? Held by the patient and stabilized by the therapist body. So that is how you will talk about the unaffected leg. And now an extension force is applied to the thigh until a barrier is felt. Okay. And then like to the affected side, what you do is you will give an extension force and the therapist is going to perform flexion. There is a counter force between that. Isometric contraction is happening. And then the patient pushes the thigh up against the physio's unyielding counter force. Okay. That is happening. And what and all additional things you can add to stretch the other muscles which we were talking about. That was the tensor fasciae lata. For tensor fasciae lata, you will give hip adduction which will localize the stretch on the tensor fasciae lata muscle. And knee flexion for rectus femoris. Hip abduction stretches the pectineus as well as the short adductors. Okay. So this was the example for lower limb MET technique, post isometric relaxation. And hamstring muscle is given. And what are the common errors performed? So firstly, joint barrier is overlocked. That is one thing. The patient pushes too hard. So basically, we were talking about for the successful performance, you need that localization and the control and balance. These are the three things you need to concentrate for you to perform MET better, right? So patient pushes too hard. That is one thing. And patient's contraction duration is too short and too few repetitions to make a change. Okay. Patient does not relax and physio does not offer stable support of limb or region. And then the therapist allows movement during contraction phase. This is one thing. Isometric contraction ka matlab hai ki you should not allow the muscle to lengthen, right? So if you allow the movement, obviously there is isotonic contraction happening in the muscle. So there the results will not be as expected. And then talking about the therapist is uncomfortable, awkward, or poorly positioned, unbalanced, or tense. So these are the common errors. Okay. So I hope you all understood. Thank you for the opportunity. Thank you, sir.
Thank you.
Thank you, ma'am.
Thank you so much. And now let us go through the queries which are posted in the chat box, and over to Gaurav sir. He will read out the questions and ma'am, you have to answer them.
Yes, ma'am. Yes.
Hello, ma'am.
Yes, Gaurav sir, please.
Ma'am, first question tha, explain the autogenic and the spindle. Hello, ma'am.
Yeah. So the autogenic and the spindle. Okay, 1 minute. So this one. So here what is happening is, first thing is autogenic inhibition. We saw that there is this Golgi tendon organ. Basically, before everything, for a muscle to perform one particular movement, one muscle should lengthen and the other should contract. Then only one particular movement will happen. So in case of autogenic inhibition, who is the head of the autogenic inhibition? This Golgi tendon organ. When there is increase in tension, this will respond to that increased tension and will inhibit the muscle contraction. That is what will happen. And in further sessions also, I told under autogenic inhibition, you have two other things, that is post isometric relaxation and post facilitation stretching, wherein we are trying to tackle the tension and trying to perform the technique to lengthen the muscle. Okay.
Okay, ma'am. There is a second question.
Okay.
Hello, ma'am.
Yes.
Restrictive barrier mean end field.
Okay. So restrictive barrier and end field are two different things. One is in end field also we have that normal end field, that pathological end field. So here restrictive barrier is where the you're not able to move to the full range. There is restriction in between. That is called restrictive barrier.
Okay, ma'am. And how to straighten them?
Huh? Yeah, for in order to how to
straighten them, यानी उनका strong कैसे करते हैं?
strengthen them.
हाँ.
So how do you strengthen the restrictive how do you strengthen the restrictive barrier? This question. Hello.
Hi, hello, ma'am.
Okay, so I didn't get your question. How do you strengthen the restrictive barrier?
Yeah, ma'am.
Okay.
Like
Example. Okay, example for restrictive barrier. See, in case of I showed you about, I was talking about the neck, upper trapezius. Okay, when you cannot perform full range of motion of your neck, that is side bending, when you cannot perform, then there is restriction. So there is restrictive barrier over there. There will be one to like primary barrier, secondary barrier, which you have to break in order to reach or lengthen that particular muscle.
Okay, ma'am.
Okay.
And ma'am, reciprocal inhibition एक बार वापस बता दीजिए.
Okay. So reciprocal inhibition. Fine. I'll give you that example. I gave you that example. So see here. Here, look into this point. When one muscle is contracted, its antagonistic muscle is automatically inhibited. Okay, that is the point. So now we'll take an example. So see here. Here, what this picture is telling, there is biceps is tight. Perform it on yourself and see. So biceps tight ho gaya hai. So there is limitation. Okay, obviously triceps is the muscle which is going to perform elbow extension. So biceps is tight, and what you do is you are giving a counter force. The person is trying to extend, and you are giving a counter force. You're not allowing elbow extension. Okay. For that, what happens during that? You will there is that isometric contraction phase. मतलब 10 second के लिए वो counter force you will perform, and you will allow isometric contraction of the muscle. उसके बाद क्या होता है? The affected muscle, you will place it in the mid range. You will perform the movement, and thereby you will break the barrier. And आपका elbow extension का range बढ़ जाता है. मतलब you are trying to activate triceps and inhibit biceps contraction. That is all. You got it?
Yes, ma'am.
Yeah.
मैम, और इसी बारे में हमें कुछ नोट्स या यही पीपीटी हमें मिल सकती है?
Yeah, sure. I'll share.
Okay, ma'am. It's over to you, Nisha.
Okay. Yes, ma'am. Now, finally, let's go in for the vote of thanks by Anil Pal, sir. Yes, sir. Yes, sir. Requesting Anil Pal, sir, for the vote of thanks.
Hello. Am I audible?
Yes, you are.
Yeah. Thank you so much, ma'am. And it was a wonderful and very knowledgeable session done by a speaker, today's speaker, Tejaswini ma'am. And I would also give thanks to Nisha ma'am for welcome speech, and Gaurav sir for taking your question and answers. Gaurav sir also thank you, ma'am. And
Anil sir, you are not audible.
as already mentioned about feedback form which are given in chat box. So please give your suggestion and opinion for betterment. And you can also give the ratings for today's webinar 1 to 10, which is 1 is very poor and best for 10. And special thanks I would like to give Saurabh sir, Vandit sir, Surbhi ma'am, and Tejaswini ma'am, behalf of Sanjeevan Physio, who read the reports for us. Thank you so much, sir, everyone. Thank you, and this is a wind up from my side.
Yes, thank you, sir. Thank you, Anilpal, sir. Thank you so much. Thank you, Tejaswini, ma'am, once again, and to all the participants as well for their active participation. Yes, and we are waiting for your feedbacks. So let's wind up for the day. Thank you and have a good evening.
Welcome. Thank you, ma'am, for the opportunity. Thank you all. Thank you.
Yeah, thank you.